Okay.
All right, we are now streaming live on YouTube, and I started the webinar, and we're just waiting for people to file in. Give it a few moments because there is a slight delay. As I see people are now starting to come in from the waiting area.
To tell you, Stephen, I used to sing in a band in my high school, and we had this song set up so that it would be playing when people came in so you wouldn't be nervous. And there was a glitch. So for my first song, it goes like diddle 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 diddle, and then you got to sing. Well, there were 400 people standing in front of me when we first did it. And I go, yeah, I'm ready, until he actually, are you ready? And I, wait a minute.
Well, we are live, Mayor, so maybe we will come up with a theme song, maybe the NFL intro.
Bill knows enough about the first ones that came in.
I don't know his name. I think, Steve, he needs to have an introductory song that he's singing with each of the events.
Well, that could be added to the future list, but we are live and we are starting, and I would like to welcome everyone to the San Ramon City update for Friday, January 22nd, 2021. We are picking up where we left off with last year's Mayor's Breakfast with a focus on COVID this morning. Future broadcasts, we will include updates from elected officials, community leaders, and city staff, and any topics that are really pertinent and of interest to the residents of San Ramon. So this morning, I'd like to go around the Zoom and introduce everybody that's on the broadcast. First, we have Mayor Hudson with the city, and he will be giving a few statements before logging off for another meeting. We also have joining us, as always, we have Supervisor Andersen to give us an update of what's going on in the county, and hopefully with a focus on vaccine distribution this morning. That's the #1 topic with San Ramon residents. We also have Ann Lucena from San Ramon Regional Medical Center to give us an update on the hospital capacity and what's going on with the ICU and treatment. We have Dr. Joseph. A pleasure to have you again, always our educator of the year, to give us the latest on the vaccine developments and what's going on with the virus. And I'd also like to introduce Simone Finney. She's our communications and engagement analyst. She's watched every one of the previous broadcasts and has helped out with the questions and answers, and she will be doing so again today. And as a reminder, please email info@sanramon.ca.gov if you have any questions, and we will be sure to work them into the broadcast. If we can't, we'll get you answers offline. And also, not only do we stream live on YouTube, but also it's recorded on YouTube. So if you want to watch later on, if you can't stay for the whole thing, feel free to go back and look at the broadcast, share with anybody that you would think is interested in it. And the beauty of YouTube is you can fast forward through every part where I'm talking and get to the good stuff later on in the broadcasts. So this morning, we usually give a brief city update, and unfortunately, our city manager, Joe Gordon, couldn't make it due to a meeting conflict. So I'll just give a very brief update as to some of the things that are going on around town. And one of the things that I like to do is let residents know some of the new businesses that are opening and coming to San Ramon. And the first one that I like to mention is that we have Ace Hardware coming to the old Orchard Supply location on Crow Canyon Road. So there's signs up right now saying that Ace Hardware will be in soon. And I know that's going to be very popular with a lot of the residents. Over at the city center, we have construction ongoing for LB Steakhouse, which is a higher end steak restaurant. Construction started also for 2 items that I'm looking forward to very much. We have Phil's Coffee coming in at the city center, and also Salt and Straw, which is a locally sourced ice cream and milkshake facility, whatever you want to call it, restaurant, which is unfortunately located close to City Hall where I'm at. So I'm going to need to do a lot of walking back and forth to burn off the calories, but Salt and Straw is very popular down in Southern California. So very excited to have those restaurants and shops under construction. So with that, I'll turn it over to Mayor Hudson for a few words.
Well, thank you, Stephen, and welcome to our currently only 4 attendees. This is our first meeting of 2021, one of many I hope that we have in the future. I again apologize in advance. I have to duck out for a meeting that unfortunately they want you to swear into things before they put you on these boards, but I will be back for the next one. That will be sooner than later, and Candace Andersen can give you my update on AVAX. See how I stuck that to you, Candace? We are continuing our focus this morning on COVID and vaccine. It's the #1 thing on everybody's mind. How's it going? What do we do? And hopefully we can move to future meetings where we talk about many of the things that we are going to do or are doing in San Ramon for you. Why and how are we doing them? There will be opportunities for other council members to speak to you, to answer questions in the future at different meetings. It's something new I hope we can institute to allow some of our elected officials to speak to you direct. It's one thing to run for office and be in front of a mic. It's another thing when you're sitting here one-to-one, looking somebody straight in the eye when they just got through asking you why you ruined their neighborhood. But again, I apologize. I do have to duck out for this swearing in, and I look forward to the next meeting. And let me turn it back to you, Stephen.
Great. Thank you, Mayor. Also this morning with limited time, but we're still very grateful that she's able to participate this morning, is Ann Lucena from San Ramon Regional Medical Center. And Ann, I just have to say, I worked in the medical industry through college. I had some very brief moments, only hours long, where I had to don PPE. So I can only imagine what you and your staff have been going through over the last months, having to work in full protective equipment all the time. So we really appreciate everything that you do for the San Ramon community. And we'd love to hear an update as to how things are going at the hospital.
Great. Well, thank you so much for having me. And I do want to echo your words of gratitude towards all the healthcare providers. It's certainly not something I can take any credit for, but the people who are actually at the bedside every day deserve a lot of credit for all the tremendous work they do. And they just do so much in a compassionate way, even while wearing a mask and so many barriers between them and the patients, they're still able to transmit that caring feeling for each person they care for. And that's pretty special. Would you like me to go into kind of some quick updates now? Okay,
Sure,
great.
that would be great.
All right, so I wanted to share a couple of things, updates on the hospital. I know the big question on everyone's mind is the vaccine, of course. First, I want to make sure I always share the same PSA that everyone is always sharing. We still need to continue doing social distancing. Please continue wearing a mask. All these things are so important to help prevent the spread. Over the last couple months, we have seen the surge that you've seen in the news, that you've seen across the state and across the country. I think it really started around Thanksgiving, and I saw a news report that there were over 1 million people that went through TSA every day for over a week around the holidays. So that's a lot of people moving around the country, which really contributes to the increased spread. And so it's very important for us to continue being vigilant. Since Thanksgiving, we did see an increase in the number of patients. As you may recall from previous reports, we had seen very low numbers from March really all the way until Thanksgiving, and then it really ramped up just as it has around all of us. And so now we've seen a little bit of a decline, and we're cautiously optimistic that the peak has passed and that we're going to get to a more stable place. But certainly that's something that all of us can contribute to by following all the precautions that CDC and the state and the county recommend. We're always able to take patients in the emergency room. We still have capacity, but that being said, we do want to be careful about making sure that people are only here when they really need it. And so we want to make sure everyone protects themselves from spreading COVID. We do have patients in our ICU who are very sick. And so that's something that we're very focused on, making sure we protect everybody and keep them from getting to this place, to the point where they need to be in the ICU. but I think we're past hopefully the worst of it, and we just need to keep following the same precautions so that it doesn't have another peak after this this last one over the holidays. I do want to talk about vaccines because that's what everyone is very interested in, and I want to give credit to the county. They have done a very good job of being very proactive, very collaborative. I think it's pretty remarkable. The Pfizer vaccine was approved on December 11th. It arrived in our county, I believe, on the 14th, and we started at our hospital vaccinating on the 16th. That is a really huge amount of effort to make sure that it rolls out so quickly. And I know other hospitals in our area also did the same. Contra Costa County has been very much providing transparency about the vaccination process. I recommend that if you're curious, you can go to the county website, and they have a lot of statistics about the vaccine distribution, how the allocations are working, and who's receiving it. And I don't want to take any of Supervisor Andersen's talking points, but I check it regularly, and I think it's a great source of information for people. Within our hospital, we've been really encouraging everybody to get vaccinated. Over 75% of our staff, I believe, have been vaccinated at this point, and more are planning to do so in the coming days and weeks, which is really a great sign. Our clinics, we've been running since that December 16th. We've been running clinics every week for our healthcare workers, not just hospital workers, but also healthcare workers in the community, including dental workers and the primary care offices. We're planning on expanding our vaccinations to community members starting next week. Right now, we're in our county, we're focused on the phase 1, tier 1, phase 1B, tier 1, which right now the emphasis is on those over 75 being prioritized, but also making it available to those over 65. And so that's something we'll be providing more information about on our website once the dates are finalized and we're able to provide signups. We are asking for people to make appointments because it's obviously very important for us to make sure we have a streamlined process. And even during the vaccination process, we need to make sure that there's social distancing at all times. So we have to make sure we have capacity and sufficient doses for everybody who comes at any given time. One thing that I get asked a lot, and I want to make sure everyone knows, is even after you get vaccinated, right now, you still have to wear a mask. So a lot of people think once you get your shot, you're free and clear and you can just have your normal life back. And that's unfortunately not the case. So please keep that in mind. First of all, whether you get the Pfizer or the Moderna, which are the two that have currently been approved for emergency or have been given emergency use authorization, they have 2 doses. So Pfizer is about 21 days apart and the Moderna is about a month apart. And it's very important that you get both doses, and that's the way that you can maximize the efficiency or the effectiveness of the vaccine. But it's also something that takes time to really take full effect. And so you're not protected just because you got the shot yesterday. And even after that period of time is over, we still need everybody to wear masks because this is a community effort and it's going to take a long time before everybody can be vaccinated. So we really want to make sure that nobody starts letting their guard down just because they've been protected themselves. From initial observations and from the anecdotes from our community, the side effects are usually mild to moderate in some cases, but it's something that can be managed, and sometimes it's chills or fevers, but things that go away on their own within a few days in most cases. And so I know everybody, and a lot of people haven't had any effect whatsoever. So we really want to encourage everyone, once you have access to it, once you're in the phase or the tier that corresponds to you, please don't be afraid of getting it. Please go out and get the vaccine. It's the right thing to do for yourself as well as for those loved ones around you and your community. So we want to encourage everybody to please consider getting vaccinated once it's your turn. And with that, I just want to say thank you to the city. You've been so supportive throughout the last almost year now of this process, and we look forward to the continued partnership. And thank you to the county as well. It's been a more communication and more collaboration than we could have ever asked for. And with this next big hurdle of mass vaccination, I think that continued relationship is very valuable, and we're very grateful for that. So I'll wrap up with that.
Thank you very much, Ann. It's a great transition over to Supervisor Andersen talking about vaccine distribution. And I have to say, Supervisor Andersen, I have relatives in many counties throughout the Bay Area, and in Contra Costa County, all of my relatives who are either in the early phases or above a certain age have already been vaccinated. And I can't really say the same for other counties. So it seems like Contra Costa is at the leading they're leading the charge in terms of getting the vaccines out to the residents. So thank you very much. It seems like everything is going great, and look forward to your update.
Okay, well, and I'm going to share my screen if that's all right. I want to just sort of walk you through initially a little bit of where we are, and then go right into the vaccination, because that really is what is so critical to all of us, is when will we get vaccinated? And so starting out, and I'm sorry, let me just go back to, I don't want the presenter. I want to play from the start, and I want a slideshow that shows just the slides, and we'll see if this works. I apologize. And instead it wants to show it this way.
And you can click that button and it should.
Okay.
Slideshow, but.
There we go. Okay, and we will go right back up there. Thank you for that technical insight. So starting out, I am just going to talk about the fact that, as Ann mentioned as well, we hope we're at the tail end of a surge, but we still are in a surge. And as of yesterday, we did have 288 people hospitalized. In context, November 1st, we had 36 people hospitalized. And you can see from this graph how significant we've been in December, almost a plateau, but a continual surge. In talking to our health officers this week, they did a presentation before the Board of Supervisors. They thought it was still likely that next week we might get up to 300 people hospitalized, but then we're very hopeful that we are at the end of this surge and we're going to start seeing numbers going down. For me, ICU beds occupied has always been a significant issue, because we never wanted to be at that point where we could help people, but we were so overwhelmed we did not have that ability to do so. And that goes back to March, when we were seeing pictures of New York, of Italy, where hospitals were so overwhelmed. So currently in Contra Costa County, 151 of our beds are occupied. Now, this is not all COVID patients, it's all ICU patients. We do have 14 beds available. And then you look at the county and you look at it in the context of the Bay Area, because as you all know, we're in a significant shelter in place order, because our ICU capacity in the San Francisco Bay Area has been below 15%. And so as of yesterday, our ICU capacity in our county was 2.3%. ICU capacity Bay Area wide was 3.4%. So to get out from under the state's shelter in place order, which is the one where, even though we're in purple tier, we don't have outdoor dining open, we don't have hair salons, nail salons, other personal services open, we have to get not exactly to the 15% ICU capacity, but using the state's model. They need to be able to project that 4 weeks from now, from the date of their modeling, we will be at 15% capacity, at which time they will lift the shelter in place order, which will allow us to go with our regular purple tier categories. And just a quick, again, looking at where we are currently, as of yesterday, 55% of all of the tests we're having 55 people per 100,000 testing positive, 10.3% testing positive, and then 15.7% of our equity adjustment. And those are people in disadvantaged communities where we have seen from the day one an unusually higher proportion number of positive cases. And this is primarily because they can't work from home. They don't have that luxury. They oftentimes might have multiple families living in much closer quarters. They don't have the ability to just quarantine when one person gets sick, even though we do have facilities to allow for that, but there's some hesitancy there. And so when I was last here, just to put it in context, which was the first week of December with Mayor Clarkson's final date, we were at 37.7 per 100,000, and we had an adjusted rate of 28 people, per 100,000. And our positivity rate in early December was much lower, 7.5%, with the equity metric about just under 12%. And so again, this is all the tiers we're in. We've got to get below 7 per 100,000 to, or that's where more than 7 per 100,000 is where we are in purple, but we've got to get below that 7 to move down to the red tier. So cases by city, San Ramon, you've seen 257 cases in the last 14 days. So it's still very, very rampant in your community. And as we all know, some people, might lose their sense of smell and have no other symptom, or maybe entirely asymptomatic. Other people may end up in the hospital. So that's why I think Ann's final comments about don't let up your guard, continue to do what we know we need to do, which is the masking, 6 feet apart, staying home as much as possible, and particularly if you have any symptoms, are so, so important. Deaths. San Ramon, you've lost 12 residents. 5 of those were in long-term care facilities, but it's still a significant number to lose 12 of your own community because of this pandemic. And on the county's website, you can see by location how many people have passed away. Danville has lost 17 people in this last 9 months that we've been in the pandemic. 478 in total in Contra Costa County. Nearly a third of those deaths were in the month of December when we really saw the numbers climb. That was 146 in December. Schools reopening, I won't jump into this other than to say the governor has come up with a new plan to try to get our schools reopened, but we cannot really even look at that in our county till we drop below 25 cases per 100,000. And then you've got some very robust guidelines that need to be followed before you can. Until we get in the red tier, once again, plans will have to be proposed that would go to the county health, to the state health, and the county office of education. County office of education has some great, great information. I was on a panel with Lynn Mackey, our county's superintendent of schools. I would recommend going there if you've got a question about schools. And I do want to express my thanks to the San Ramon Valley Unified School District Board. They have been working tirelessly. Everyone's goal is to get our kids back in school as soon as we possibly can and as soon as we safely can. So let's talk about vaccines. Now today, in about 45 minutes, there's going to be a press conference where they're going to be launching. We are shooting for 1 million vaccines by the 4th of July. And that is a very robust, exciting goal. To get there, we would really like to have the goal of 9,000 vaccines per day. And again, we're getting very close to having the infrastructure there, where we've got the partners in place to administer the vaccines. As Ann was mentioning, at San Ramon Regional, they're ready to vaccinate. Shout out to San Ramon Valley Fire Chief Paige Meyer and his entire group, who have been doing a lot of our vaccinations of the first responders, of those who are eligible in the first tier 1A and then tier 1B. And so go to our dashboard. As Ann mentioned, it's updated regularly throughout the day, and will give you a really clear picture of where we are in our county. To date, this was really as of yesterday when I captured this screenshot, we have administered over 57,000 vaccines, 47,000 plus were their first dose, just under 10,000 second dose. And so right now, 5% of our county population, 16 and older, have been vaccinated, and 1% have received their second dose. And so this is a good thing. Obviously, as we're looking at community spread, the more people who are vaccinated, the less chance of that being spread. There is a very clear timeline, and the timeline is really following the CDC, the Center for Disease Control's timeline, along with state guidelines. And then within the county, we have a committee that is made up of healthcare professionals and others that come up with sort of the ethical distribution, which really to date has just mirrored what is allowed by the state. And so as you can see from this timeline, phase 1A has been our healthcare workers, and our employees and residents of long-term care facilities. And we've had great partnerships, particularly with some of our local pharmacies and chain drugstores, of going into our larger long-term care facilities, administering these doses, great partnerships with our healthcare partners in making sure this happens as well. And right now we're in the phase where we are working with some of the smaller, under 35 homes, skilled nursing facilities, and we are actually moving into the even smaller, 6-person or less congregate care facilities. Again, it's with our partnerships, fire, with our healthcare providers who are really making sure that this very, very vulnerable population, particularly when they're in a congregate care setting, even as small as 6 people, are getting the vaccine, because as you've all seen from day one, that's who we're losing primarily. It is the people who are over 75 who are dying at a much higher rate, and particularly if they are in a congregate care setting. So phase 1B did start, and that's people ages 75 or over. And also the state did throw in 65 to 74 years old. And again, it's based on the science of who's really being affected by it, who's having the most extreme impact when they get the virus, and who's succumbing to the virus. And so this is what really started in January, launched it, and I'll get into the whole appointment process, but we have been very successful in just filling people in. And while people who are 65 and older are allowed to also request appointments through the county's website, we continue to prioritize 75 and older. We want to make sure that they get their vaccine first. 65 and older are filled in where spaces are available. And so sometimes people who put in a request for a vaccine may not hear back right away because we haven't found the right spot for them. And right now, we're really grateful that our healthcare providers are jumping on board, and they are now lots of great messaging. And I happen to receive my medical care through John Muir, and I appreciate that. Just even this morning, got another important notice just saying, this is when your turn is. I'm 60 years old, so I don't qualify yet. At some point, I will be vaccinated, I'm sure, but it was really helpful. My 90-year-old father, who actually is receiving his vaccine in Hawaii and got his first dose this last Tuesday because he had seen John Muir physicians, even he was getting notices because he was in their database. So look to your healthcare provider. They are the ones where you can easily log in, but the county system will also be helpful. We aren't sure yet when we're going to be able to roll into other frontline essential workers, which could be school teachers, grocery store workers, bus drivers, those who can't help but because of their profession come in contact with the general public when that will take place. Congregate care settings with outbreak risks. In some cases, those have already begun, depending upon where the outbreak risk has been. And so those are taking place as needed. So we're hopeful that we will continue to roll this out. The biggest issue is how much vaccine we're going to get. And we generally do not know until a week before the county how much we will get. Now, some larger statewide providers, such as Kaiser, such as Sutter, they get their supplies independently from the state. The county, though, is primarily responsible for smaller providers, and we also are providing vaccines through Safeway, through CVS, through Rite Aid, and so they rely upon us for their vaccine supply as well. But we are the ones who are scheduling at your local Safeway pharmacy or your local Rite Aid pharmacy to receive the vaccinations there. So how do you sign up when it's your phase? And start with your own provider. Again, that's what we're strongly encouraging you to do, but we're not prohibiting you either from signing up at the county site, which is the coronavirus.cchealth.org/get vaccinated. And there you click on a form, and over here there's excuse me, I went too fast. You can click to request, and you essentially, it's almost like you're filling out a Google Doc. You put in your information, your insurance information, your healthcare provider, and then if an appointment is available, you will receive an email. And as I mentioned again, if you're 75 or older, your appointment will be prioritized. It's not always going to be conveniently located, at the local CVS pharmacy or the local Safeway pharmacy. It may be, suggesting you go to Concord or San Pablo or someplace else where we've got a larger scale clinic where we can get you in faster. And we appreciate your patience. We recognize that a lot of people, particularly in the older than 75 phase, are not able to navigate the internet as easily. When my dad needed his vaccine appointment, I was the one who logged into his healthcare provider's MyChart and filled out the form so he could get his first vaccine. So if you have trouble with the internet, we do have a call number. It's 1-833-829-2626. And this is not to ask questions about vaccines. It really is just to schedule appointments. And we encourage people who need to schedule their appointments that way. So this is a great chart that will show you how many vaccines are administered by day. It's updated. There's a little lag time, and that's really because you have to manually enter each vaccine as it's given. Somebody's doing that. And so sometimes there's a few days lag. The gray at the end of the chart is the lag time. And so it will probably catch up to the rest of the chart. But as I mentioned, biggest challenge is how much vaccine we're going to get. Yes, we heard the president say he wants, 100 million vaccines out, and we in the county want 1 million vaccines out by the 4th of July. But it really is going to depend upon how quickly we can roll that out. It's been helpful with the Moderna vaccine now being the 1 watt that was sidelined for a while because of some severe reactions in San Diego. That's now been opened up, and that's helpful because many of our providers have been relying upon some of those doses as well. So vaccinations, as I mentioned, they're taking place all over the county. The blue triangles are some of our higher volume Contra Costa health sites where we are doing it. The big green is high volume non-Contra Costa health sites. And the one you're seeing in San Ramon, I'm pretty sure is the one that has been rolled out by San Ramon Valley Fire, where they have been doing, I think yesterday, Chief Meyer indicated 800 vaccines just yesterday. They are very quick. They've been doing drive-throughs, but again, all of these, you have to have an appointment. In our county, we have felt it's critical that you have an appointment first, rather than just showing up. I saw on the TV news last night, long lines snaking around the Oakland BART station of older infirm people with masks, certainly not 6 feet apart. And we're really trying to avoid that. That's why we are scheduling appointments, getting you in, once you get the vaccine, having you wait 15 minutes just to ensure there is not a reaction. But everyone I know who has had the vaccine has really expressed how painless it is, how important it is. And when you look at this map, a week from now, 2 weeks from now, you're going to see many, many more sites. We are going onto our community college sites besides the county health clinics. And as Ann mentioned, as they get more vaccine, as they have more availability, you're going to see many of our providers doing much more of what I would deem more of a mass vaccination than a smaller scale vaccination. And the smaller triangles that you're seeing are generally our healthcare, pharmacies in our grocery stores, in our drug stores that are there filling the appointments that we have through our Contra Costa County scheduling system. Now, this is a fun chart. Doses by recipient city of residence. It's not where they got the vaccine, it's where they actually live. And so as you look down there, you can see that in San Ramon, you've got your population of just over 83,000 people. Already 3,800 doses have been administered, and receiving the first dose has been 3,100 people. And that's about 3.8% of your population. Not a lot yet, but as more and more people get populated, that's far fewer people that will likely be transmitting the virus. And I always say my office is always there to serve you. So by all means, reach out to us. We do have our office staffed by phone every single day. And if you don't get my e-blast, I do send out a weekly e-blast. Contact my office, email my office, and we would be very happy to enroll you. And we give updates on what's happening with COVID as well as other important county issues. And that is my presentation, and I will stick around, Steve, if people have questions for me later on.
Great, thank you, Supervisor Andersen. Yes, we do have some questions for you. And also I wanted to mention that whenever we have a presentation on the broadcast, we make sure to isolate that clip and put it out on YouTube. So if you want to go back and look at any of the charts or need to refer to anything that Supervisor Andersen mentioned, we will have a separate clip with her presentation on YouTube later. Now with that, I'd like to turn to Dr. Joseph. Dr. Joseph, as always, very much appreciated you presenting and being on the broadcast. And again, whenever we put up your clips online of your presentations, it always gets a lot of views, and the residents are very grateful for some of the up-to-date information that you provide. So with that, Dr. Joseph, I'll turn it over to you.
Well, thank you, Stephen. It's always a pleasure. And as I said earlier, Happy New Year to everyone. Today, since the vaccine is such a hot topic, I thought I would limit my comments to that. And I will share the screen. And if we can do that, are you on board with that?
Yep, you should be able to share your screen. There we go.
All right. So this is how I see what's happening right now. We're looking at two very, very fast moving locomotives. And right now, the surging cases are still winning, but we want the vaccine train, hopefully within the next couple of quarters, within the next 6 months, to surpass the surging cases. And once that happens, and I'm confident that it will, once that happens, there's going to be major changes in what we recommend, and most importantly, what we can do. So this race is still going on, and it is not neck and neck. Unfortunately, the cases are winning, the hospitalizations are up, and there still are people who are not surviving this disease. I'm going to talk mostly about the vaccine, but let me mention one thing. And what I usually do here, as you know, Stephen, is I try to address the questions that I get on a daily basis and then try to answer those in public. Just a couple of comments about the variants. In the United States, we typically do not look for variants or mutations in viral diseases. Other countries do, particularly United Kingdom. Since United Kingdom, Denmark, South Africa have identified some stable variants of this virus, this is the coronavirus, then we are now starting to look more closely for variations or mutations. Currently, regarding the vaccines, the two that are out, they cover all of the variants. So they've all been looked at. The antibodies that respond to those who have been successfully vaccinated do cover the variants. Regarding diagnostic testing, there are three commercial tests that will not pick up the UK variant. That's the B117 variant, and that's disturbing. So now we have to look at variants around the world and evaluate our diagnostic tests to make sure that we don't miss any. And then I think it's been mentioned here before, but the variant of the UK, the concern of that one is that it is more infectious, more contagious. An individual who has that variant sheds more virus than the wild type or non-variation, non-mutated strain. So variants are in the future. Right now, vaccines are effective, but we must watch to make sure that the vaccines don't lose their effectiveness if there is a mutation. So let me talk a little bit about vaccines and try to answer some questions. These were the statistics that were reported to the FDA. And what I've done is I've combined both the Pfizer, BioNTech, and Moderna NIH vaccines in numbers. They were, as most people know, they were presented to the FDA advisory panels just a few weeks apart. Totally, there's about 36,000 who were vaccinated and were followed very carefully. 36,000 got placebo. The new cases of COVID, there were 20 in the vaccinees and 354 in the placebo. Now, you've heard that the vaccines have 94 to 95% efficacy. That is a completely different formula that has to be used by the FDA or by companies who are presenting information to the FDA so that historically vaccines can be compared. It really is a fantastic number because most of the vaccines that we have in the United States are somewhere between 50 and 75% effective. These vaccines are in the mid-90s. But to translate these results to what is important to an individual, it means that if a person is successfully vaccinated, and what I mean by successfully vaccinated means that they get 2 doses of vaccine and they have a good vaccine response, meaning that the blood test shows that the vaccine works. The risk of getting COVID is about 1 in 2,000. Now, all of this information is based on 36,000 individuals who have been vaccinated. But in the United States, we have already given vaccine to 16.5 million people. So a lot of information is expected to come out. All of the information that we have relayed to the general public and to our patients is based on the clinical trials. Now we are gathering data on very large number of patients, including side effects, efficacy, the duration, the durability. Will it work against the variants? And if we have this same ratio, that is that the vaccine doesn't prevent disease in about 1 in 2,000, we can anticipate of those 16 million people who have been vaccinated, there may be about 8,000 new cases. That means about 8,000 people will not have a good response to the vaccine. Those are the current numbers that are projected, and actually we hope that it's truly much better. So this is a work in progress. We start off with a small number of people, but then you can see how many people have been vaccinated, and the monitoring is going on in a much more robust fashion now, so that we can be sure that the vaccines are the right ones and the ones that work. And this is just two of the products that are released now. There will be 3 others released relatively soon, 3 other vaccines. Another question that I think I get as much as any is pregnancy. Now, in the clinical trials, a woman who was pregnant was not permitted to enroll in the trial. So of those 36,000 individuals, 18 were subsequently found to have been pregnant. At least it wasn't identified at the time of the trial, or they got pregnant unintentionally during the trial. All women who were enrolled in the clinical trials were advised to defer pregnancy until the study was over. So there was only 18 women in clinical trials. What I can tell you about all of those is there was no complications from the vaccine, no complications. Finally, we can now say there were no complications to the baby either. But what is more important is what was published last week, and that was the single study that we have in the United States. So this is out of Boston at a very, very good series of hospitals. Over 6,000 women who had COVID at some time during pregnancy. And then the study compared that to over 400,000 women matched for age who did not have pregnancy. And this is what we know as of today. Those who were pregnant had much more severe COVID disease. They had a 26 times the incidence of being hospitalized with respiratory failure, mechanical ventilation, which is really what one is trying to avoid the most with this disease. Also, substantially higher rates of preterm labor, preterm birth, preeclampsia, thrombotic events, and other complications of pregnancy. Now, what we know so far is that there's no identified complications from the vaccine to either mom or the baby, but we are very early. But because of the complications of the disease, the CDC and the American College of Obstetrics and Gynecology both state that the vaccine is not contraindicated for an individual who is pregnant. Now, that's not true of all vaccines, but for those who are pregnant, the vaccine is not contraindicated. So now it comes down to an individual decision, and I truly respect the concern that mom would have about this vaccine only having been available for a couple of months, only having been studied since last July. So the final bottom line is this: avoid COVID during pregnancy. That's where it becomes an individual decision. If a woman is working in a setting where she is likely to be exposed to COVID, the vaccine should be considered and taken. An example would be an ICU nurse, a first responder, someone who's in the emergency room, someone who is a medical office where patients are coming in daily. That is a continuing exposure in a community that is still surging with virus. Now, the opposite would be someone who says, look, I don't work. My husband works from home. We never leave our house. We don't even have a bubble. There's no possible way I'm going to be exposed. Well, that woman then might say, I'm going to hold off on vaccine and evaluate each month. I have never advised someone not to get vaccinated during pregnancy, but I have advised many people that your situation and your risk is so low, maybe you want to hold off and evaluate every month. So it's an individual decision, but most important, avoid COVID during pregnancy and take whatever measures that apply to you. Now, this has been alluded to already. After the vaccine, if a person is successfully vaccinated, and if you notice, I'm always using this term successfully vaccinated, meaning that you've had 2 doses and the vaccine works. That is, the blood test shows that the vaccine worked. Can you spread disease? Well, this is unknown. Now, we, in the field of theoretic science, we think it's extremely unlikely because this does not occur after any other vaccine preventable respiratory disease. So for example, measles, mumps, rubella, if one is successfully vaccinated, those are respiratory diseases, and they get exposed, they will not get infected. The reason this is a little bit different is not only because we're so new into this disease, but if there is a variant or a mutation of the virus and the vaccine doesn't work against that, then that person can get infected and spread disease. So until we have more information, we are assuming that it's possible to spread disease. And I can assure you studies are ongoing to answer this question in a scientific fashion. Are boosters coming? Yes. So in analyzing the blood test response to vaccines in the clinical trials, it looks like this vaccine is lasting longer than originally thought. It looks like the vaccine will last at least a year and maybe longer. So for that reason, booster studies in those who are in the original clinical trial have been postponed and will not start until July. But every month, those 36,000 people who enrolled in the clinical trials are being followed to see if their blood tests are still showing a lot of protective antibodies. And if they are, then the timing of the booster will be pushed out even further. So at least for the 2 vaccines that we have right now, they appear to be effective for at least a year. Now, what about a vaccine passport? And a vaccine passport means, will you be asked to show that you have had a vaccine to either get on a plane, enter a country, return to the United States, go into a restaurant, go into retail? And probably yes is the answer. There's precedent for this. So those of you who are world travelers know that there are many countries in the world that you cannot cross the border unless you have proof of yellow fever. If you have a yellow fever vaccine, you can enter the country. If you don't, you cannot. That's a precedent. In healthcare facilities, it's common during flu season to require healthcare workers to have a flu shot if they're going to work on a ward without a mask. So there is precedent for this. And as time goes on, this may become an important part of the future. Now, this was alluded by others. Should we continue masking, distancing? And what about an exposure? If an individual has received 2 doses of either Pfizer or Moderna vaccine and they get exposed, do they have to quarantine? And what about those individuals who work in facilities where they have to be tested on a regular basis, whether it's every week, every 2 weeks, every month? Should they continue to be tested if they've had the vaccine? And the answer to all of these is yes, based on this graph. Now, this is not a Contra Costa graph. I was pretty familiar with it. The Contra Costa stuff would be presented by others. But as you can see, this curve has not turned around. This is a contemporary curve. This shows what's going on as of this month. And the new cases, the hospitalized individuals, and the deaths have not started to decrease. Now, once this curve turns around, and I'm optimistic that it will, once this curve turns around, we will be reevaluating on a national level Do you need to mask and practice social distancing if you've been vaccinated? If you have been successfully vaccinated and you're exposed to someone, do you need to quarantine? And what about recommended testing? I work in a facility where I have to be tested every week, and I have been vaccinated, but I still have to get tested every week. If we see this coming down and as we get more information, then that too may change. So just in summary, right now the vaccine looks very, very good, but it is too early to say that having the vaccine will alter anything that we do on a daily basis. And then my last slide is this. This still is the recommendation. The basic 5 measures to protect yourself from getting COVID. Universal face coverings when you're out of your own house and especially indoors. Physical distancing of still at least 6 feet, even outside. Avoiding crowds and congregate settings. You all know now that outdoors are much safer than indoors because of air circulation and air exchange. And that's what protects us from this virus. This is a respiratory virus. It's in the air, and the more air exchanges, the better. And then finally, hand washing or hand sanitizing continues to be critically important. And so with that, Steve, I will stop. I'm not going to talk anymore. It's a vaccine day. These represent the majority of the questions that I get. So thank you very much.
Well, thank you, Dr. Joseph. As always, love your presentations. And I think there's this general perception that once the vaccine's out and everybody's vaccinated, we no longer have to worry about it. But you're showing us that there's still a lot of work to be done to understand all the mutations and everything that's going on with the virus. So again, really appreciate your presentations. And
Thank
now
you.
I'd like to turn it over to Simone. Simone, I'm sure we have some questions for Dr. Joseph and Supervisor Andersen.
Good morning, we do. Our first question is for Supervisor Andersen. How long does it take after I fill out the county's online vaccine form to receive instructions for scheduling an appointment?
And it's a great question, and it really depends. Last week, we were getting approximately 1,000 requests per hour for vaccinations. And so when those 1,000 come in, they start prioritizing, as I mentioned, 75 and older. So some people might get a response within hours or within the same hour that they submitted it. Someone else, it could be several days. And so we're telling people, just wait a week or so, and if you still don't have a response, then go ahead and contact not the scheduling line, but the general line, and hopefully they will be able to then make sure that your request was received. But they really are just putting them into slots as quickly as slots become available, but again, prioritizing. If you're over 75, it's more likely than not, you're gonna get a response right away. If you're in that 65-year-old to 74-year-old, it may be a little bit longer, and it just really depends. And they do try, if possible, to give you appointments close to where you live, but that is not always possible. That's just, they more importantly, they wanna get you vaccinated somewhere.
Thank you. The next question is for Dr. Joseph. Besides the Pfizer and Moderna vaccines, are any other companies close to applying for emergency use authorization from the FDA? You alluded to this earlier.
Yes, 2. AstraZeneca will be, they're gathering their data right now, and they should be applying within the next month, followed shortly by Johnson & Johnson. Of the top 5, we now have 2. Those are the next 2. Both of those vaccines are an entirely different platform. The 2 vaccines that have been released are based on messenger RNA. These 2 vaccines use a viral vector. They're completely different. The AstraZeneca vaccine is from England, is being used over there, and that requires 2 doses. The Johnson & Johnson vaccine was developed in the United States and is a single dose vaccine. I can't comment on the effectiveness compared to what we have now because the information has not yet been released to the public.
Thank you. Next question is for Supervisor Andersen, and this is combining a couple that are similar. I know you showed the chart earlier of the phases and tiers. So we've had a question about when the vaccine will be available to people 50 years and older, and also for anybody under the age of 65, how will they know when they're eligible?
You will hear about it. Yeah, and we don't know. I mean, it really is coming down to how quickly can we get more vaccine, because we're going to get it into arms as quickly as we get it. And that's really going to dictate when we can move on to the next phase. And sort of we describe it sort of like boarding an airplane. Even if you miss your phase, like if you're 75 and we open it up to 50 and older, of course, the 75-year-olds can still get in line. But we hope by later this spring, we hope that in a couple of months, we will be able to do the next phase, which includes the other frontline workers, and then moving into those who perhaps are over the age of 50. But it just depends on the supply, how quickly we can. Way to be notified is you will definitely hear from the county, and that's going to be important. But we are relying so heavily upon our healthcare partners. And most people do have, if they don't even have a primary care physician, they have some affiliation because they've received treatment at, whether it be San Ramon Regional or at John Muir or at Kaiser or a Sutter facility or Palo Alto or Stanford. Those healthcare providers are doing a great job of providing that information, and they are sending out appointment invitations to people who qualify. And so I would really continue to go to your healthcare provider's website, as well as look at those emails. Don't just send them automatically to your spam folder when they come in from your healthcare provider, and then go to the county website, because we update daily where we are in the process. But I think you'll hear loudly and clearly once we move into the next phase.
Great, thank you. Next question is for Dr. Joseph. Within the last week, several countries have updated mask mandates to require either an N95 or a surgical mask to offer the wearer more protection from virus particles. So with the new variant circulating, should we be wearing masks that can offer particle protection for ourselves and those around us?
We haven't gone there yet because of the lack of availability of the high filtration masks. So the N95 or the KN95 has very specific performance specifications, meaning that it will filter 95% of particles of 0.3 microns or less. That only works if the mask is fitted tightly around the face. So it has to be fitted over the nose, over the cheeks, around the jaw, and under the chin, so that on inhalation, air must go through the mask. The ones that are being sold commercially, most of them are KN95s, meaning they're made in another country, are loosely fitting and provide very little more than tightly woven cotton. So in a hospital setting, or when we're caring for patients who have an infectious disease that is spread by respiratory, we wear a mask that is so tight around us that we actually have to go through testing to prove that nothing goes around the outside. That's fantastic. But just to put that on someone without specialized testing is misleading. So the answer, no for the United States. Tightly woven cotton or layered cotton is still equally as effective as a loose fitting KN95 or N95.
Thank you. And actually, you both covered a lot of the questions we had in your presentations. The last question we have is for Supervisor Andersen. Is Contra Costa County planning to open a mass vaccination site?
We already have what I consider mass vaccination sites through our healthcare centers and at some of our community colleges, but they won't be just show up. They will be by appointment. And we are continuing, as I mentioned, looking at even larger venues where we can serve even more, which would include some of our community college campuses and include, potentially other large venues. But we don't have a major stadium or other locations such as that, but we are ready to scale up as soon as we have that vaccine. And for us, it's so critical that we have it throughout the entire county. And we really want to focus too in some of our communities where it's an equity issue, because they are having a disproportionate number of cases based on their population. We want to make sure we get the vaccine in those areas. And so we're being very cognizant of that. And we are planning right now, for example, out at Rossmore, which you don't think of as a disadvantaged community, but they do have obviously a very high population over the age of 75. A week from now, we are supposed to be launching a mass vaccination site there, and it will be through Kaiser and John Muir, who will be running the clinic with the help of the county, but to get that entire senior population vaccinated as quickly as possible. And so you'll continue to see it by region, by demographic. We're really targeting, honing in to ensure that we can really help the most vulnerable first.
Great, thank you.
All right, well, and we are keeping it just to about an hour. I'd like to thank Supervisor Andersen and Dr. Joseph for taking the time out of their day to present and also put together two wonderful presentations. Also like to thank Ann Lucena and Mayor Hudson for making appearances as well. As I mentioned at the beginning of the broadcast, we are planning on doing at a minimum of monthly city updates over Zoom like this, covering all sorts of topics. So we will see you next month in February. Watch the city's social feeds for announcements of the next topic and the next meeting. So with that, please keep distance between each other, wear your masks, and stay safe. So thank you.